nervous. Oh my God, I'm nervous. Okay. Um, so we are presenting on cystic fibrosis. It's me, Carla, Jackie, Lindsay, Juanita, Brittany, Monica, Blanca, and Nicole. Okay. So, what is it? What's cystic fibrosis? So, the diagnosis is a genetic disorder that affects respiratory, digestive, and reproductive systems. It is caused by the mutation of the CFTR gene. So the patho would be mutations in the CFTR gene that lead to impaired chloride ion transport across cell membranes, resulting in the production of thick, viscous mucus. A health promotion would be high calorie, high protein, high fat diet, do not restrict sodium, and increase fluid intake. So you might be asking, what is the CFTR gene? So this gene produces a protein to regulate the movement of chloride and sodium across epithelial membranes. So the sodium and chloride regulate water content within mucus. This creates thin fluid-like mucus. They also help with ciliary clearance. So thin fluid-like mucus traps debris, pathogens, and bacteria. Ciliary clearance helps our respiratory passage stay clear.
Okay, so what are the risk factors? So one of the risk factors would be a genetic inheritance, which means a person must inherit two defective copies of the CFTR gene, one from each parent to develop the disease. If a person inherits only one of the defective CFTR gene, they are a carrier but do not have the CF. Um, which is the cystic fibrosis. Another would be family history, having parents with siblings or other family members with cystic fibrosis increases the likelihood of inheriting the disease. Ethnicity, which is more common in Italian Caucasians or Northern European descent, Hispanic, Native Americans, the Middle Eastern population, African and Asian populations. Another thing would be the I can't say that word, but consanguinity, which means marriages between close relatives, which increases the risk for inheritance, the two copies of the defective gene. And then the last one would be geographic locations, which means cystic fibrosis is more frequently diagnosed in regions where the carrier rate is high, such as Northern America, Europe, and Australia.
Okay, so some of the expected findings in cystic fibrosis is wheezing, dry, non-productive cough, dyspnea, parox, I can't pronounce that, paroxysmal cough, mucus plugs, atelectasis on X-ray, cyanosis, barrel-shaped chest, clubbing of the fingers and toes, multiple episodes of bronchitis or bronchopneumonia, large, loose, fatty, sticky, foul smelling stools, ver voracious appetite early, loss of appetite and late, failure to gain weight or weight loss, distended abdomen, thin legs and arms, deficiency of fat soluble vitamins, um, sweat, tears, and saliva are abnormally salty, viscous cervical mucus, decreased or absent sperm.
Lab tests and diagnostic procedures would be an AMBRI test, which is genetic testing for mutations in the CFTR gene. There is an IRT lab with the infant heel prick. It's going to show an elevated IRT. The one that actually diagnoses it is the positive sweat sodium chloride test. They're performed at 2 weeks old and it measures the chloride levels in the sweat. It'll be greater than or equal to 60. Don't know what that stands for, sorry guys. But that's what it confirms. And then stool screening measures the presence and levels of trypsin and chymotrypsin, which are enzymes produced by the pancreas. And those will be low, and the poop will be like a whitish, grayish color.
So because this does affect the lungs, the priority is going to be airway clearance. So this is done through percussion, postural drainage, anything that's chest physiotherapy. Sometimes oxygen as well is needed. Medications like bronchodilators and anything that will thin out mucus for GI care as well. Because they have pancreatic insufficiency, they'll take the enzymes to help break that down. They do need a high protein, high calorie diet to keep up with their metabolic needs. They do need more, including the vitamins that are fat soluble like A, D, E, and K. Um, and then for infection control, anything small like a common cold is worse with them because they already have so much thick mucus. So you do want to have them in a protective area, avoid crowds, sick people. You do want to encourage them to get their flu and like pneumonia vaccines as well. As far as exercise, anything that's okay with them that won't overexert them, but no, like everyday exercise is encouraged just to kind of keep their lungs and everything working better. And of course, psychological support, because they are isolated to avoid getting sick. A lot of them can get depressed, and there is no cure for this. So again, you just kind of have to keep their mental health in mind. And for therapeutic procedures, for chest physiotherapy, it could be like percussion, vibration chests, like mentioned before, the postural drainage. The positive expiratory pressure therapy would be breathing out against resistance to help keep the airways open and improve the mucus clearance. The high frequency chest wall that one will help dislodge any mucus in the airways in a non-invasive way. Inhalation therapy, it would be anything like nebulizers and like medications. And then the lung transplant, if it's bad enough, they will need that as well.
Okay, and these are the medications that are administered for cystic fibrosis: albuterol, Proventil, ipraproteum, bromide, atrovent, fluticasone, I don't know how to pronounce that, or Flonase, propionate, Psalm, Etrilo or Advair, Dornase alpha, and vitamins are also given. And all these are administered to either thin the music, thin the mucus and to make it easier to cough up, or to open up the airways, the bronchioles.
So, for client education, you want to urge the understanding and overview of cystic fibrosis to the family, the parents. Cystic fibrosis is a disease that someone's born with, caused by a genetic mutation, and it prevents exocrine glands in the body from properly functioning. You want to instruct the client on how to use a nebulizer with medication like albuterol. This could be done at home as well. You want to emphasize the importance of drinking increased fluids to help loosen the mucus plug, or just mucus in general, all the buildup in their lungs. Electrolyte-rich drinks can also help in replacing the sodium lost in sweat due to the hyponatremia. You also want to consider possible diet modifications, a high calorie, high protein diet with healthy fats and added fiber, excuse me. So that's like your lean meats, your poultry, your fish, your eggs, beans, legumes, avocados, nuts, seeds, olive oil, your fatty fish. Um, you want to also monitor your client's oxygen saturation levels using a pulse oximeter at home. That's something that anyone can buy, even off of Amazon, um, and it's really handy. You also want to monitor signs of difficult labored breathing in the person, the client. Yeah.
All right, there are key members of the cystic fibrosis care team and their roles. Pulmonologist oversees the respiratory health, prescribes medications, bronchodilators, mucolytics, antibiotics, and monitors lung function. We have the respiratory therapist who provides the airway clearance techniques, the gastroenterologist who is going to manage the digestive and nutritional issues such as pancreatic enzyme replacement therapy and liver complications. We have a dietitian nutritionist who ensures the adequate nutrition, caloric intake, and vitamin supplementation. A pharmacist that helps with the medication management, ensuring the proper use. We have the nurse and nurse practitioner, which coordinates the care, provides patient education, and assists with daily management. We have a physical therapist who designs the exercise programs, a social worker that assists with access to the resources, such as like the insurance and psychosocial support for the patients. Um, Psychologist or psychiatrist, which is going to address the mental health concerns. And we have the genetic counselor, which educates families about the genetic aspects of cystic fibrosis and helps with the family planning decisions.
So some of the safety considerations and complications, one of the most important things is to check for allergies and emphasize the importance of up-to-date immunizations and for your patient to get the annual flu vaccine. Some complications that can occur, one for in your respiratory system is chronic lung infections, pulmonary obstruction, chronic bronchitis, and respiratory failure. Part of your complications in digestive is pancreatic insufficiency, diabetes, and cirrhosis. And due to malabsorption, the cystic fibrosis patient can experience poor growth, bone disease, and fatigue. And almost all men with cystic fibrosis are infertile due to the blockage of the vas deferens, and the women's cervix may have a thicker mucus, which can cause refused fertility.